Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to show you how we can show improved outcomes and better results with our treatment approach. So first, let's take a step back, and we're going to go over this example here where it goes over the signs and symptoms, an evaluation, a diagnosis, a treatment, the cost, and the actual outcome. And let's use an example of lower back pain. It's one of the most common injuries. So your signs and symptom, you have lower back pain. Your evaluation, it may take you weeks or months to get in to see the specialist, but finally you get in to see one specialist. They maybe take some imaging that increases the cost of your care, and guess what? You're diagnosed with lower back pain, which you already knew you had lower back pain, but it didn't get specific, and they were like, go and see a specialist. So you go for a second eval, and maybe you get some injections, maybe some MRIs, and you're told to either rest or avoid these activities, but you're still diagnosed with maybe a more specific one, whether it's a herniated disc, stenosis, whatever, but you have lower back pain, but you really haven't started any treatment for it yet or solved the root cause of the problem. And then again, maybe you'll get a third eval for the same case of lower back pain, and maybe you're sent to either a PT or even a chiropractor, and you go from there. So it's been weeks and almost months already, and you really haven't gotten any true treatment for this. And the problem is you walked in with lower back pain, and you have this lower back pain still, and you were diagnosed with a general term of lower back pain. You already knew that walking into it. So the next step is, what's the best way to treat that? So this way, you may try, some medications, you may try some injections, and what's the long-term outcome regarding those? So, if not, poor. And this will increase the cost of care. If you do this, surgery would be the last option for any lower back pain case, and that's going to definitely inflate the cost. And a lot of surgical outcomes, are so and iffy. Fusions only have a 50% success rate. And then if you go down the physiotherapy or chiropractic route, maybe you'll be seen 3 times a week for 4 weeks. And the problem with this approach is that you're still being treated for just general lower back pain. And the problem here is with this treatment approach is the more treatments you do, the more evals you do, the more times you're seen, the increased cost will be, and it doesn't necessarily mean that you're getting a better outcome with this. So this is a general approach to just standard care. The problem is the diagnosis is not specific enough. No one has solved the root cause of why you're having the low back pain. And in this system, it's set up that the more treatments you do, the more visits you come in, the more evals you get, the higher the cost is, the more money that's being made. And your outcome is not dictated based off of what is best for you. So let's use that same kind of outline here, and let me show you how Pursuit Physiotherapy and our staff here and our treatment approach can actually get you a better outcome. So we start here, again, signs and symptoms. I have lower back pain. On the phone call, you are categorized and placed specifically with the best therapist for your case. So not only are you just seeing someone randomly just because the schedule's open, but you are actually, you don't even know this, but when someone calls, you are getting placed with the appropriate therapist that is best fit for you. So your eval is going to be with the best person depending on how you describe your symptoms over the phone. Okay? Normally, we don't have waiting periods here, so we can get you in within the week. Okay, during the eval, okay, you are seen by that specialist, and on day 1, if you have red flags, like a major medical emergency or things that are beyond my scope of practice or my team's scope of practice, you're instantly referred out to someone, okay? And then from there, our main goal of the eval is 3 things. We want to solve the root cause of what is causing your pain. And it's not normally just a low back pain diagnosis. What is causing you to have your pain? 2, we look at risk factors. Okay? if you come here and you leave here pain-free every time, but you go to work and you have 2 risk factors there that keep bringing the back pain back, you know, I could treat this all I want. If we don't resolve the risk factor, your back pain will always keep coming back. And then the third thing during the eval is going to be, what is the best treatment option for you? You know, there's literature and research out there in medicine that that shows that this treatment approach is proven to work for this type of back pain. Okay, so during the eval, you're only going to be seen by the board certified specialist. We'll get you in within the week. We'll roll out red flags, and we solve these 3 things during the eval. Okay, now from there, you're never going to leave here with just a diagnosis of low back pain. You're going to know exactly what is causing your back pain and what type you have. Now let's show you an example of this, how specific we get during the eval with this. So we know you have lower back pain, but what type of low back pain do you have? Because it's going to dictate what treatment is best for you. So, do you have a low back pain from a herniated disc that's very flexion sensitive, like a sciatica type case, or you have leg pain because of your back pain? Or do you have a sensitivity like flexion or extension? Someone who has extension sensitivity may have some arthritis or stenosis and stuff like that, or older in age. You treat that totally different than how you treat a herniated disc with back pain. Do you just have a flexion sensitivity, meaning you're always bending forward, you're always sitting, or sitting disease? That's another option there. Do you have unilateral or bilateral back pain? Unilateral back pain, maybe there's something on that same side that is predisposing you to have that same back pain. Whether it's a compression, whether it's a leg length, anything. Or is it bilateral? The next step is, do you have an SI joint problem? Not all low back pain is the same. If you have a true SI joint problem, but you're being treated for a herniated disc, you're going to miss the root cause, and you'll get a failed outcome from this. So is your low back pain a pelvis problem? Do you have a sacral problem? So the sacrum can mimic lower back pain too. Is the hip flexor, you know, your hip flexor attaches from your hip to your lumbar spine at L2 to L4. So is your hip flexor the root cause of your problem that's pulling on your low back, causing lower back pain? Or is it a hip pathology? Sometimes some rare cases, you can actually have a hip labral tear and it mimics lower back pain, but that's a far case. But you could see the different types of low back pain that there are just from this video, that we will place you in and categorize which type of low back pain you have. So from this, at the end of the eval, you'll know exactly what type of low back pain you have, what's the best way to treat it, and better yet, what is the cost. So in our model, the treatment and how much treatment you get and the more evals you get doesn't dictate your cost. Your diagnosis and prognosis and what is best for you will dictate the cost. Okay, so we actually flip this. And so this is flipped. The amount of treatment you get does not dictate cost here. So from this, we know through evidence and research and what is, the best practice for you, that if I know that I can get you better in 2 to 4 visits, I know and I owe it to you to get you better in 2 to 4 visits. So the way you treat a herniated disc is going to be totally different than how you treat the SI joint. So from this, you will clearly know the amount, our timeline, the amount it's going to cost you, and what's the best way to treat your type of low back pain. And this will expedite the outcomes, expedite the results, and make it more cost effective for you, the patient. Okay? And another thing is too, in very complex cases that failed surgeries and failed multiple treatment approaches, again, you probably heard me say this, we believe it's not right to ask you to pay money for treatment if we can't truly help you. So many complex cases here get money back guarantees. So if you failed multiple treatments and you want us to try or to see if we can solve your lower back pain, then there's money back guarantees with our treatment packages. So this entails that if you are a non-responder and you don't respond to our treatment, then at least you can get your money back, and no one else in healthcare offers that. But anyway, so after the eval, you get your diagnosis, and then you know exactly how much it's going to cost you to treat your lower back pain. And then from there, this will guide your treatment specifically down this route for each case. Okay? If you do a general lower back pain treatment with just some stretches and exercises for 3 to 4 weeks, you're missing the root cause. Your low back pain needs to be categorized and specific into this case and these impairments, and then it will dictate your treatment that will give you the better outcome in fewer visits, and it's more cost effective. A lot of times it'll be even cheaper in our treatment approach versus standard care. So I hope you learned something from this. This just goes into the complexity and the detail of our treatment approach and how we are able to show better outcomes and fewer visits and better results for our patients. It's not as quick and easy as you think sometimes, but doing our step-by-step process, we can identify clearly what is the cause of your pain, what are some risk factors, and what's the best way to treat it. And as we work through our process and solve the root cause of your problem, this will allow us to get the better outcome in the fewer visits. So thank you for tuning in, and I hope to hear from you soon.